Hi, my name is Liping Guo from Lanzhou University of China. My presentation is about prevalence and changes in depressive symptoms among the postgraduate students. It's a systematic review and a meta-analysis from 1918 to 2020. As we all know, depression is characterized as feeling sad or having a depressed mood. All patients will experiencing loss of interest or pleasure. The WHO has reported that depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of disease. Here the study showed that education is strongly associated with well-being and health, but numerous researchers indicated that postgraduate students are at high risk for depression. For example, based on the natural survey from 26 countries, 39% of students reported moderate to severe depressive symptoms, which was 6 times higher than that in general population. Here are some debates on the prevalence of depression among the postgraduate students. So, our study was aimed to solve these problems. The first, what is the prevalence of depressive symptoms among the postgraduate students? And how has this prevalence changed? Is this prevalence mediated by student or study level characteristics? All our process of methods were followed by the PRISMA guideline. We included 37 primary studies in this meta-analysis. The results show the prevalence of overall depressive symptoms among the postgraduate students was 35%. Specifically, the mild depressive symptoms among the postgraduate students was 23%, and the major depressive symptoms was 19%. Overall, the prevalence of depressive symptoms in postgraduate students remained relatively constant, while the prevalence of major depressive symptoms decreased significantly. Studies utilized non-random sampling reported a higher prevalence of mild depressive symptoms than random sampling. And the doctoral students reported a higher prevalence of overall depression than that of master's students. As shown in the table, there is no significant differences within region or measure. Our conclusions. More than one-third of postgraduate students were at high risk of depression. The doctoral students experienced more depressive symptoms than master's students. The prevalence of depressive symptoms among postgraduate students remained stable between 1980 to 2020. In all, postgraduate students are at a high risk of depression, and the school administrators, teachers, and students should take joint action to prevent mental disorder of them from deteriorating. That's all. Thanks.